Okay, hi, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. And right out of the gate, I can tell you that this is not exactly what we were expecting to find. And let me show you why. Your biceps tendon, I'm going to bring it into the joint. That's your biceps running up towards 12 o'clock on the screen. And a slap lesion is when this biceps anchor is torn, which yours most certainly is here, okay? Now, the other part, though, is, you talked about this Buford complex, and what we're seeing is that you've got a tear. So see how this tear goes into the biceps tendon. So it's really kind of a type 4 slap lesion, which is when the tear goes up into the biceps. I'm not quite sure if it's really a Buford complex. I guess it kind of is. There's not much labrum from here, and it looks like before this tore, that was coming across like that. But then it started to tear into the biceps. So we've got a couple decisions to make, and I'll walk you through that. I don't know. The problem is this is torn where we can't really reattach that back. We'll keep working on this, show you some more in a minute. Okay, so again, not a standard slap lesion, not even a standard slap lesion with a Buford complex. So you've kind of hit the jackpot here. What I've been doing, just to show you, is we've been taking cartilage off right here. See the yellow bone? And that's going to give me a good place to try and get some of this labrum to heal. I don't know if we're going to be able to fully reattach this part right up here because it was never attached in the first place. And as I pull back and look at this, you can now see with a little more clarity, I think, exactly what we're dealing with. So as we look here, I think we're going to take an anchor and put an anchor down right about here to save this posterior labrum like that. Okay. Why don't we, did you already open a 1-3? Open a 1-8 for me. And maybe we'll put in a double loaded anchor here and put one stitch through the labrum and perhaps another one, try and capture this MGL if we can. We'll decide that in a minute though. Okay, you can see we're using a single cannula technique here. And what we've just done is placed a 1.3 millimeter, back up a little bit, give me a little more perspective, a 1.3 millimeter single loaded anchor. And now we'll show you what that looks like in a minute. Pause. Okay, so we've got one anchor down. You can see the suture there. And that's doing a good job. The problem, as you see, is this kind of middle glenohumeral ligament's torn. And I think there may be something we can do for that. Let's have a look. Pause. Okay, so we've got another anchor tied here. It's looking like a normal shoulder almost. It's a normal shoulder with a cord-like middle glenohumeral ligament. But we know that this is still torn, and we've got to do something about that if we're going to save the ligament, which is important for shoulder stability here. So I think we're going to place one more 1.3 millimeter anchor right here, and we're going to have to put some sutures through there to get that repaired. And then we'll deal with the biceps tenodesis part. 60. Okay, so we're done. We've released the biceps. We've got two anchors in to repair the labrum, primarily the posterior labrum. That anterior labrum, or the anterior portion of the ligament, we had to resect back to there because it was just too thin to even hold a stitch. We've already released the biceps, and we're going to get ready to go tenodese that in just a minute here. So I just wanted to show you, we're finishing up inside the joint. We're going to go get to work above the joint. The rotator cuff looks just fine, by the way. Okay? Okay, so we're in the subacromial space. When we talk about taking off a bone spur, That's what this is here. You don't really have a big spur to worry about, so that's good. Your clavicle is right over here. We'll just sweep underneath it just to make sure there's nothing to worry about here. Okay, we'll clean things up a little bit and show you some more in a minute. Okay, so we were able to tenodesis the biceps in the subacromial space. That cord is the biceps, and it's anchored to the bone. You can see as you rotate your shoulder, it's not going anywhere. So we're going to finish up here and get you back to the recovery room shortly. Good luck to you now. I'm glad we didn't have to make that incision in the armpit too. I think in the long run you'll have a little easier go in the post-operative period. Good luck to you now. Bye-bye.